the results of Keynote-024 suggested that in patients who were greater than 50% PD-L1 positive, that the use of pembrolizumab was superior to standard chemotherapy. However, in that study, there were only 19% patients with squamous carcinoma. So it was a minority of patients. When you look at a very granular level, did the squamous patients have the same survival benefit that the non-squamous patients had? And I think it's not entirely clear. If you look at less than 50% with the population, I think the data to me is pretty clear that monotherapy is not an option for those patients, and that should be chemo-immunotherapy combinations. Because of the small representation of squamous patients in the Keynote-024 trial, many of the patients that I have with squamous cell that are above 50%, I still use combination of chemotherapy, immunotherapy, because it's a very small number of patients. It's not clear that survival is clearly better in the squamous subset. So I err on the side of making sure that we get control of the disease. And I think control of the disease in general is better with chemo plus immunotherapy. Now, I don't feel the same way in patients with non-squamous cancer, but in squamous, it's the uncommon patient that I would recommend monotherapy for. Typically, I think the best strategy is chemoimmunotherapy in the squamous population.